Well, hi there. My name is Amy Joyce. I am the director of the Office of Child Care at the Early Learning Division. And I'm here today with my colleague, Christine, to talk about the recent guidelines that came out about child care in Oregon, as well as the whole emergency child care system that we have going now during the COVID-19 crisis. I've been the director of the OCC since October of 2019, so not all that long. And then we came right into the COVID crisis. So here we are trying to do our best, all of us, the state, providers, parents, kids, all together trying to do our best. And we want to give you some more information so you can continue to do great work serving kids and families in Oregon. Christine, would you introduce yourself?
Yes, hi. I'm Christina Christian. I'm a licensing specialist. I operate out of the Tualatin field office. I've been with the Office of Child Care for about a year and a half, but I've been in the field of early childhood education for over 30 years, doing a lot from the other side of things, where I was working in centers and a little bit of in-home care. So a good variety of background, and I get it from both sides. So, and I'm happy to be here today.
Great. Well, thanks for joining us. And here we go.
We're going to start off with some questions about operating emergency childcare today. And Amy, our first question is, when is childcare going back to normal operations?
Well, Christine, the answer to that is actually we don't know. As Dr. Fauci, we all quote Dr. Fauci over and over when he says, we don't make the timeline, the virus makes the timeline. So we're going to be under emergency child care for a while. It's not business as usual right now, and only approved emergency child care is allowed to operate. So we're operating under the governor's executive order, the temporary order from Miriam Calderon, the director of the Early Learning Division, and new guidance that came out recently. You need to be approved to be operating emergency child care and operating under those restrictions and guidelines.
Great. What about the phased reopening of counties in Oregon?
Well, this is interesting. This is a big misconception that's been going around, I think, for a while. Childcare, the guidance about childcare really it's statewide. It does not vary county by county. And some of the phased reopening that we've heard about in some counties last week and today, as we're recording this, is Friday. Additional counties reopening today. But childcare is the guidelines are statewide, and so you need to be adhering to those statewide regardless of what county you're in.
So who can child care providers serve?
So since the beginning of the emergency child care system that was put in place, the directive was to prioritize the essential workforce. Now, another common misconception is that the essential workforce is very limited to people like medical professionals, police and firefighters, EMS, and grocery store workers. The reality is that the essential workforce is very expansive. We had a link on our website to a document, both a summary and then pages and pages of federal guidance about who's in the essential workforce. And really, I think about it in terms of who in our economy is essential to sort of keep our economy going, from, truck drivers and grocery store workers and food processors and all kinds of folks. So be sure to look at that to see who is included in the essential workforce, and you may be surprised to find out how many folks are. So prioritizing essential workforce has been the directive since the beginning, but with the recent guidance that came out last week, we're also telling folks you're able to welcome back to your child care those families who are returning to work and might not be part of the essential workforce as we define that term, but really are going back to work. So welcome those families back to childcare. And as always, the directive was to prioritize these folks. It's never been the case that you could only serve essential workforce. but we do want to prioritize them so we can be sure that those folks do have the childcare they need to be doing the essential work as we try to get through this crisis.
Great. We're going to move on to some questions about exclusion practices. When can I exclude a child or a staff from care?
So this is a challenging topic. I'm not going to pretend it's not. And this has changed a little bit over time. And I do want to encourage folks to go to our website and look through. There's sort of a 3-step question that you would go through to figure this out. But here's the general rules. So if a child or a staff member is sick and they also have a cough or a fever or shortness of breath, right? Those are the primary symptoms that we see for COVID. If they're sick and have one of those symptoms, they should go home and they should get a COVID-19 test. If that test comes back positive, or if the person does not get the test, they need to be excluded from care for at least 10 days and 72 hours, which is 3 days, of which, in addition to that, they are fever-free and their COVID-19 symptoms are improving. Now, if they take the test and it's negative for COVID-19, the person can return, again, staff or a childcare child, can return after 72 hours that again are fever-free and their other symptoms are improving. Now, real quick, mention about what we mean by fever-free. So that means the temperature is less than 100.4 degrees Fahrenheit and the person isn't taking any fever-reducing medications like Tylenol. They have to actually be fever-free.
How about what if you are exposed to a person who tests positive for COVID-19 or has a presumptive case of COVID-19?
Right. So that person, if you're exposed, needs to quarantine for 14 days while having no symptoms. 14 days is that incubation period for COVID-19, or the period of time during which, if you have contracted it, that you would show symptoms. So 14 days of quarantine showing no symptoms. Then during that period, if you do start to develop symptoms, you need to consult with your doctor and potentially get a test, because you now have a presumptive case of COVID-19 or may have a presumptive case of COVID-19. Presumptive means you've been exposed to someone with a positive test and you have at least one of those symptoms, the cough, the fever, or the shortness of breath.
What if you're exposed to a person who is exposed and has entered quarantine for COVID-19, but you have no symptoms?
So here's a bit of good news, right? If this is the situation, you are not excluded from childcare, whether staff or a child. However, you should consult with local public health if you do have any concerns.
We're going to move on to some questions about ratios and stable groups. How many children can I care for, and can I swap slots?
So from the beginning of the emergency childcare situation, what we've said is a stable group of 10 kids. Stable means consistent, right? The same group of children. And the upper limit was 10. And of course, that's always subject to things like ratio and supervision in your space. However, with the new guidance that came out, there is some allowance for what we're calling swapping slots. And so there's an allowance to have up to 12 children in your group of kids that are in your stable group, although only 10 can be on site at a time. And this is going to allow you to swap some kids for like AM, PM situations or different days of the week. So a good way to think about this, I didn't come up with this, but it's a fantastic analogy, is to think about it like a sports team. So you would have 12 kids on the team, but only 10 kids can be playing at one time. And if you look at that graphic that's up there, Christine, you can see up in the top here, we've got 12 little bodies, 12 kids, and then only 10 showing up at a time, but swapping out kids from among that team.
I think that's a great analogy. Thank you for sharing that.
Great.
What is required? What is the required height for a barrier or a divider between stable groups of children?
Yeah, this is something where we've worked with the Oregon Health Authority on keeping groups separate. So whether we've got a certified center or a certified family home, there is the situation where you might have two different rooms with your stable group of 10 or the 10 kids from the group of 12. But we need to keep them separated. Again, this is that idea where we don't want the virus spreading amongst large groups of people. Oregon Health Authority talks about the density of people. The more dense the group of people, the more likely that the virus can spread if somebody's infected. So what we want to see here is a barrier that's at least 4 feet high in order to properly keep children apart from one another.
What materials make a good barrier or a divider?
Yeah, so if we think about kids in childcare, there's no illusion that kids are, sitting quietly on the floor and never wanting to interact with one another. Of course they are. That's we want to encourage kids to play and be active and to be doing their thing in childcare. But so we've got to have a material in that barrier that's sufficient or substantial enough that kids aren't going to be able to crawl, over, through, under it. So we're talking about a substantial barrier, not something like cones or tape just to demarcate a line between the rooms, and not even something like a curtain or a bed sheet, because that's really probably not going to keep the kids from interacting with one another. So we're talking about a physical barrier.
What is the maximum number of groups that can be in a large room?
Yeah, so we've talked about this quite a bit with the health authority, and we know that, for instance, in some very large centers, you might have a room that's big enough that could accommodate more than 2 stable groups, even with that 4 foot high physical barrier. But again, that idea of keeping the density of people down and lowered, the decision was that there can only be 2 stable groups in a large room. And if you do have questions about this, please get with your licensing specialist and talk through it. But it is the maximum of 2 groups in a separated large room.
Great. Questions about face coverings and testing is next. Who should wear a face covering and when?
So let's start with talking about who should not wear a face covering. So infants, children under 2, any child who doesn't have the capacity to adjust that face mask should never be wearing a face covering. This is a safety issue. Please don't do it. Children over the age of 2 and up to 5 can wear a face covering if that's the parent's choice, but they need to be supervised. Again, that's a safety issue. So in terms of requirements for wearing a face covering, we've got 2 of those in the current guidance. One is for the staff that are doing the health checks in the morning when kids arrive, and we're doing that health check to make sure that folks don't have a fever or coughs and that sort of thing. And the guidance we've gotten from the health authority is that staff should be wearing a face covering, and that's really a protection for the staff member, because that's the instance where the kid's going to almost necessarily be in very close proximity with you as a staff member, and we want to protect in case the child coughs or sneezes, as kids do, protect that staff member from that airborne virus. So that is a requirement. And the second time is for floater staff. So we have, the staff who are in the classroom all day, and then the floaters who go back and forth for breaks and things like that. And because of that interchange between rooms and different groups, health authority guidance is that those floater staff should be wearing that facial covering all day long. And I know, Christine, I think we've gotten some questions and concerns about this one. Can you speak to that a little bit about some of the concerns we've heard?
Yeah. some of the concerns primarily around, wearing a face covering can be scary to the children. And so, the competing priority of wanting to make sure that children are comfortable and are welcome into care, but then they're greeted with somebody with a face covering, and that's very scary to them.
Yeah. Thanks for talking about that and flagging it. And we have heard that from people, and we recognize that. And this is the situation in so many of these things that we're talking about today, and some of the other aspects of this guidance, and the reality of the virus and how we're dealing with it is we end up with these competing values. So we've got the value of protecting the physical health of the staff, so the desire to wear the mask. And then we've got the competing value of the, sort of emotional health and the concern for the children and what they're seeing. And that's what we're all wrestling with, are some of these competing values. And so in this situation, in this instance where we landed with the health authority, is it's more important for that brief period of time during that health check, particularly for the staff to be wearing that facial covering to protect them. We recognize, particularly in home-based care, that person doing the health check may be the owner of the home-based care and may go inside and then immediately take that mask off. We recognize that, but it's that close proximity that we know is going to happen during that health check that makes it important to be wearing that mask, again, to protect the staff member.
Great. How do providers access COVID-19 testing?
Yeah. So the Oregon Health Authority indicates that childcare children and staff can be referred for COVID testing if they have any of those COVID type symptoms, right? Fever, cough, difficulty breathing. Childcare children and staff can be tested at the Oregon State Public Health Lab if they have any of those symptoms, and that lab can consider testing even if they're not showing any symptoms. Please check our website and the FAQs about this. It may be the case that you're going to need to talk to your medical provider, to your doctor. You may need to pay for it with your health insurance. But the health authority has indicated with guidance that came out right before the new child care guidance came out that child care is sort of a prioritized situation where child care children and staff do get priority for COVID testing at this time. So Christine, I wanted to close at this point with talking about some upcoming additional information sessions that we're going to be conducting. We know that people have a lot of questions and we continue to answer those. So again, check our website for the frequently asked questions. We update them almost every day so that you can have the latest thinking. And then two, we did on May 14th in the evening, we did an English language presentation and a little bit of Q&A. And the following Saturday, we did a Spanish language version. And we provided some information, and that was right after the guidance came out. There were a lot of questions that helped us populate that Q&A on the website. And then in addition, what we heard from providers was it would be much more helpful if we could separate those out into different times to have those sessions based on the type of care being provided. And so next week, Tuesday, Wednesday, and Thursday, May 26th, 27th, and 28th, we're going to do English language sessions for registered family, and then certified family, and then certified centers on different nights, because some of the guidance is a little bit different, and certainly your layouts and your scenarios are different in those different areas. So we're providing that time and space for you all to come and ask us questions. Look to our website for more information on that. And then the following Saturday, May 30th, we're going to do another Spanish language. That's going to be for all types of providers, but in Spanish, so that we can speak to folks about their questions and any additional thinking that we're doing. Christine, I did want to mention one thing. This is challenging for everyone, for providers and for families and for the kids. And what I, as the director of OCC, want to encourage is for this to be something of a conversation. So Some of this is learning as we go. And some of the ideas and the new guidance that came out came directly to us from providers. So if people have questions, they should absolutely ask their licensor or send that question into the email that we have for questions to come in about the guidance, about what you can be doing, about any questions that you have. And if you have ideas of ways the guidance could improve, if you think we got it wrong in the guidance and you can tell us why, we've taken some of those things and say, hey, we've heard you. We're gonna kick that around some more. We're gonna talk to OHA some more and see if we can maybe adjust some of those things. Some of those things have happened already. Again, look to that FAQ. So we continue to try to improve that, to respond to some of the challenges that we know providers are facing. As they try to navigate this whole situation. So please try to make that conversation where we can have that two-way communication and try to make improvements as we go along to assist you, the providers, in providing that great care we know you do, while also protecting the health and safety of the kids and your staff. Christine, any final thoughts from you in the work that you do and the way you work with providers on the front lines?
Just that we are here to support you, here to help you, and want to make sure that we can answer questions that you have, support you in any way that we possibly can. We know that the work is hard, especially during this time, and we're here and available for you. So please reach out if you need us. Great.
Thanks to all of you for all that you do, and please join us on May 26th, 27th, 28th, and for our Spanish-speaking providers on May 30th. Just so you all know, there's going to be a Spanish language version of this recording conducted by our ELD director, Miriam Calderon, and a licensing specialist who speaks Spanish as well, to try to accommodate the vast majority of our providers. Do let us know what questions you have, and do let us know ideas you have to improve what we're doing, so we can serve everybody in Oregon. Thanks for all you're doing. Stay healthy and safe. Thank you.